A patient undergoes surgery for rectal cancer. Injury to the nerves near the first blood vessel tied during the operation most commonly causes which complication? The right answer is option B, sympathetic nerve injury causing retrograde ejaculation and bladder dysfunction. During ligation of the inferior mesenteric artery, the nearby superior hypogastric sympathetic plexus may be injured, leading to these complications. A woman has persistent acne that has not improved despite treatment with oral isotretinoin and antibiotics. What is the next best step in evaluating her condition? Here the right answer is option D, evaluate for hyperandrogenism. Acne that does not respond to standard treatment may be caused by high androgen levels. So, hormonal disorders such as PCOS should be investigated. A young woman develops a painless sore in the genital area along with swollen but painless growing lymph nodes. What is the most likely diagnosis? The right answer here is option C, syphilis. Primary syphilis typically presents with a painless genital ulcer, that is chancre, and non-tender enlarged inguinal lymph nodes. A patient is scheduled for cardiac surgery. Which antibiotic is the best choice to prevent surgical site infection before the operation? Right answer is option A, cefazolin. It is the preferred antibiotic for preoperative prophylaxis in cardiac surgery because it effectively prevents the bacteria that commonly cause surgical site infections. A woman with hearing loss undergoes a Rinne test. It is negative at 256 Hz and 512 Hz but positive at 1024 Hz. What is the most likely airborne gap? The right answer is option C, 30 to 45 decibel. A Rinne test that is negative at 256 Hz and 512 Hz but positive at 1024 Hz indicates a moderate to conductive hearing loss with an airborne gap of about 30 to 45 decibel. A 10-year-old child has recurrent tonsillitis with a sore throat, fever and pain in the ear. Which nerve carries the referred ear pain? Here the right answer is option B, tympanic branch of the glossopharyngeal nerve. The glossopharyngeal nerve supplies both the tonsils and the middle ear. So, pain from the tonsils can be felt in the ear. A patient with bronchial asthma is using an inhaled steroid. He develops white patches on the tongue and inside the cheeks. Which medicine is the best treatment? The right answer is option B, clotrimazole. Inhaled steroids can cause oral candidiasis. Clotrimazole treats this fungal infection and rinsing the mouth after using steroid inhalers helps prevent it. A woman with bronchial asthma develops heavy bleeding after giving birth. Which medicine should be avoided while treating her postpartum hemorrhage? The right answer is option A, carboprost. Because it can cause bronchospasm, making it unsafe for women with asthma, oxytocin is the safest first choice medicine for postpartum hemorrhage. A patient has numbness and tingling in the thumb, index finger and middle finger, especially at night. The symptoms improve when he hangs his hand over the side of the bed. Which condition does he mostly likely have and which test is used to diagnose age? Here the right answer is option C, carpal tunnel syndrome and Duncan's test. Compression of the median nerve causes numbness in the lateral three fingers, especially at night. Duncan's test reproduces the symptoms by pressing over the carpal tunnel. A patient with schizophrenia did not improve after taking haloperidol and thioredoxine. He was started on another medicine. Later, he developed excessive salivation, high blood sugar and high cholesterol levels. Which drug is most likely responsible? The right answer here is option D, clozapine. It is used for treatment-resistant schizophrenia and commonly causes excessive salivation, weight gain, high blood sugar and high cholesterol. In this situation, regular blood count monitoring is also needed because of the risk of agranulocytosis.